alaikum, dear APPNA members. This is your host, Dr. Tariq Alam, yet again with another episode of APPNA Committee Cafe Series. This session is going to be about the Merit Committee of APPNA. It's a very meritorious committee, and we are fortunate to have both co-chairs, Dr. Sadiq Naveed and Dr. Saad Usmani, join us. Thank you, gentlemen, for joining the show.
Thank you.
So, Sadiq, let me start this with you. Can you tell a little bit about yourself and what motivated you to join this committee?
Yeah, thank you very much, first of all, for having us here. And it is obviously, my pleasure and honor to serve along with Dr. Usmani, who is one of the renowned multiple myeloma physicians across the globe. So I graduated from Nishtar Medical College in 2005, and I did my residency in general psychiatry from Griffin Memorial Hospital, Norman, Oklahoma. Then I did my child and adolescent fellowship from University of Kansas. I began my journey with APPNA somewhere in 2016 from YPC platform. You can say that I have always been interested in medical education, more of as an educator. Even when I was not in a medical educator job, right now I'm serving as a psychiatry program director at University of Connecticut, psych residency program at ECHN. But even when I was purely in a clinical job, I was working with YPC and focused more on medical education. So Merit actually, the mandate of Merit, which is focused on medical education, research, innovation, and transfer of knowledge, it aligns with my interests and my personal interests and professional interests. So that's how I got interested in Merit, and that's how my journey with Merit started.
Wonderful. And Dr. Usmani, if you can just say a little bit about yourself and what motivated you to join this committee.
Certainly. So, kind of following Sadiq's lead here, I'm originally from Lahore, went to Allama Iqbal Medical College, graduated in 2002 and came to the US for my residency training in Wayne State before going to fellowship at the University of Connecticut. And during that time, Dr. Atiq Mirza and his better half were gracious and kind to us. They were practicing physicians and faculty in the Hartford area. And Dr. Atiq Mirza introduced me to not just the Allama Iqbal Alumni Association, but also to APPNA. So since my fellowship days back in 2008-9, I did get involved with both organizations, and Merit was initiated around that time within APPNA. I think doctors Baba Rao, Shahid Rafiq, Nahid Usmani had kind of led that effort. So I kind of participated as a foot soldier in several of those initial initiatives. And my last engagement with Merit was probably back in 2017-18, and then I went quiescent because from an academic career standpoint, things were very busy for me at that time. So I got invited again to be part of this committee, and it's really wonderful to see all the work that's been done. Sadiq has actually done a lot of wonderful work for this committee, and so it's really been a privilege being part of this and trying to contribute any way I can. Not that Sadiq needs any help.
Well, that's lovely to hear from both of you about your academic journey, career, and now involvement with Merit. So, Sadiq, my next question to you is that a lot of people know Merit as a committee, both here in the US and in Pakistan, but maybe a lot of people don't know what Merit actually stands for. So what does Merit stand for, and how does it fulfill APPNA's long-standing mission?
Yeah, so one reference point that people can take is I will urge them to listen to the first cafe that you held with Dr. Danish Bhatti. He is one of the actually leaders of the Merit and has played a role. So he has much more institutional memory in that regard. But, the Merit actually stands for medical education, research, innovation, and transfer of knowledge. The counterpart, another committee which has similar goals, is RISA, Research, Education, and Scientific Affairs Committee. Merit mostly focuses on Pakistan, and RISA mostly focus on with this almost similar mandate in United States. We do different educational initiatives in Pakistan, and as Dr. Danish Bhatti mentioned in very first cafe that I had time to hear, it was originally to improve the medical education. So they did a lot of curriculum update. So that's what we are focusing on: improving the medical education, creating an environment of research, and transfer of knowledge.
I see. Merit, of course, has done a lot of work. So basically, just to summarize, Merit is primarily associated with education in Pakistan, transfer of knowledge, whereas RISA is more for US-based physicians who need CMEs and other professional achievements next to the name. Correct?
Yeah,
Right.
I certainly agree with that.
Right. So we hear a lot of things that happens in Merit. Merit is doing an epilepsy course. It's done a geriatrician course. It's done a stroke course, and a lot of courses and many other specialities. So how do you determine that which course needs to be done now? I mean, is there any feedback that you get? And then how are those courses designed? Because there's a lot of planning that goes into, designing the curriculum.
Yeah, no. So certainly, participant feedback is important. So we have different social media platforms. We have an APPNA Merit WhatsApp group, which has roughly about 500 participants. We have Merit Discord groups. So when I became chair last year, so I did like an informal survey from the participant. I asked them what kind of resources are they looking from Merit platform. And then, you can also see where the deficiencies are. So for example, research is one area that we are, beginning to work on. So some informal feedback, and then, some from personal anecdotal experience. So based on the feedback that we got from participants from Pakistan, there were certain courses developed based on that. So based on that, the feedback, we started to develop certain courses. I was involved in Merit, indirectly from 2022, 2023, when we developed different psychiatry courses under the banner of APPNA. So for example, we did a course on infectious disease last year, HIV. Our neurology colleagues do an ongoing mini stroke fellowship, which is where we have participants all across the globe, not only from Pakistan, and it is very competitive. They have a list of criteria that they go through, and they select the participants. So let's say, if based on the feedback, if I have to develop a course, I will reach out to people. And this is where, I think it is a blessing to be part of the diverse cohort of physicians. So for example, if I need a course and on hematology and oncology, so I'll just reach out to Dr. Saad Usmani. I reached out to Dr. Faz Anwar, and Dr. Saad Usmani also joined that effort. So we are leading an effort where we are doing webinars on hematology and oncology. We are also doing similar webinars on nephrology. So in this way, I think we are taking multi-pronged approach. We are involving our subspecialty networks like psychiatry, nephrology, oncology, infectious disease. And, when we involve them, it also, those people, being a psychiatrist, I may not have relationship with oncologists and hematologists in Pakistan or neurologists in Pakistan, but those colleagues, they do have those relationships. So it also brings stakeholders in Pakistan along. So it is like, multi stakeholder engagement in Pakistan and in the US.
Right.
So if I can add a few more things, I think, that local stakeholder piece is extremely important. I think that's the reason why some of the long-standing initiatives in Merit have really thrived. The HIV course, as an example, Sadiq, it's really been successful because of not just the North American APPNA physicians and researchers who wanted to have that initiative, but they were also in line or in contact with the local stakeholders and were able to get people on the government side of things to join and help with that initiative. Similarly, with the hematology oncology forum, I think we already had a pre-existing relationship, and we just brought that into the Merit fold, and it's been successful. Then I think there is a separate initiative looking at the research infrastructure and how to do that. I think that's been a very good initiative and has been one of the longest running ones. I think, Sadiq, you can probably highlight that one as well. I think that is a very an area of unmet need for our region in general, and South Asia in general, but Pakistan in particular. I think this is where we can bring that transfer of knowledge to our homeland and actually help people appreciate the merits, no pun intended, the merits of being research oriented in their approach and really trying to do better for our people back home.
Excellent. So, I mean, all the points that you have raised is just phenomenal. I mean, this transfer of knowledge is really at the heart of APPNA's mission, and that's what you're doing. So, Sadiq, one question, I mean, in your response that you said that you get the feedback from people in Pakistan, and based on that, you develop, I mean, the committee develops different courses that are a requirement over there. So my question is that how do you approach these people in Pakistan? I mean, do you collaborate with medical colleges and universities, or you collaborate with the specialty societies back in Pakistan? How do you who do you interact with there?
So I was Merit Chair last year too, in 2024, and this year too. So it has been, I think, because our colleagues here in different specialties, they have relationship with specialty association back home, so it's easy to interact with them than the medical schools, but so that's how we interact with them, and they also give their feedback. Okay, we think we need to be added. So like Dr. Saad Usmani mentioned about HIV course, so I was looking at just looking at the numbers. So we have an HIV WhatsApp group which has 70 participants, physicians from Pakistan, and also physicians and non-physician from Pakistan, and physician and non-physician from USA, which are working on HIV care in Pakistan. So we developed the course together. We also bring speakers along, and they talk about those topics. Just to build on that, and then I'll come back to your question on the medical schools. So based on that, HIV collaboration, we signed a MOU with Department of Sindh, HIV control, where we offered them to provide free access to all of our HIV course, which is an exhaustive course, and I think about 40 people joined that course, and they are doing that. So, and we are developing those relationships. About medical schools, it is a little bit tougher, and then because of the time difference, it's difficult to bring people along when it comes to the medical school. But I met with our family medicine colleagues just a couple of weeks ago from Merit Platform. So we had a really good meeting. Dr. Zaid Rafiq and some other colleagues are developing a family medicine diploma in Rawalpindi University. So I think sometimes these relationships, they take time to build on. For me, what I've seen is easier to go through specialty associations, and then we can certainly make some change along them in multiple medical schools. But for the medical schools and universities, medical universities, one example would be Rawalpindi University, where they are developing a family medicine diploma program, or more like a 2-year degree course program. And this is just being I think it's starting in pretty soon, or it has already started. So we just had that meeting a couple of weeks ago.
I think collaboration is the key. and it's at the heart of merit, collaborating between different institutions in Pakistan. And really, that is something which we in APPNA are very aware of, networking and collaborating.
Yeah.
So that's very exciting to know. You mentioned about course, you mentioned about diploma, you mentioned about a fellowship, you mentioned about a mini fellowship. So, who decides, or what is the criteria for something to be called a course, or something to be called a fellowship, or a mini fellowship, or a diploma? And is APPNA actually authorized to give these diplomas? What is the value of these diplomas and fellowships that's given by APPNA?
So only course that has been called more like a mini fellowship is the stroke course. So they do have collaboration back home. They were working on some collaboration with Health Services Academy to have that accreditation to call it a mini fellowship. Rest of almost all the educational products are called courses. So I do agree with you that we generally tend to avoid calling it fellowship or mini fellowship because that lacks the clinical interaction that it's must to have like a
I
more
see.
sophisticated training program. But in the stroke mini fellowship, it is when you look at their structure, it is probably very well designed. They also have an opportunity for those people who are involved in stroke mini fellowships to do the clinical observerships or to get the clinical experience. And I know that they were working on collaboration with Health Services Academy of Pakistan. The diploma that I was talking about, family medicine, is going to happen through the Rawalpindi Medical University. So in that case, Rawalpindi Medical Institution University will become sort of a sponsoring institution for that diploma.
I see. The other point is that uh, there are so many courses that are happening over here, and it seems that this is a very academic oriented committee of APPNA, because it's all transfer of knowledge. So the members who are part of your committee, do they have to be in academics, or anyone who has an interest can be uh, involved in this committee?
So anyone can do this. I think as long as you're interested in medical education, research, and just to give my background. So I'm still not in a university setting. I came in more of a formal academic role in about 2, 3 years ago. So I think as long as you're interested in spreading the wealth of the medical knowledge that exists, and you want to be that full soldier, it's open to you. We had a CME series last year where we invited speakers from APPNA platform, and quite few of them were actually the private practitioners. So anyone who is interested in advancing the mission of merit, they are welcome to join. So it is not restricted to whether it's for academics or it's for private practice physicians. But certainly it sort of attracts more of the academicians, people with academic interest, because it also aligns with your
Yeah.
professional track too. So what I've seen is, and that's why I value APPNA so much, because the work I have done in APPNA, it also coincides with or aligns with my professional interests too.
Excellent. And Saad, the next question is directed towards you. We know that a lot of students from Pakistan, they come to the US in search for residency, and getting a residency is becoming very, very tough. As part of the application process, they need to have US clinical experience or some kind of US experience. So there are so many US board certified physicians in APNA and who are working in merit. So, from that perspective, what do you say, or what role do you see merit assuming in trying to, sort of have some kind of a research background that we can give to these students, so that when they come to the US in search for residency, they have a little bit of a more competitive application?
So I think there are other initiatives within APPNA, YPC as an example, that actually help on that front. I think the courses that Merit is creating, especially in the context of research, are going to be extremely important. The other thing that Merit is trying to do, and this is a collaborative effort with RISA and APPNA at large, actually, is to develop leadership focused essentially leadership development, and that eventually will also translate to medical students, or young graduates who are seeking out residency positions to make their applications competitive. It's an aspirational goal, and it's kind of in the a project in the works. But that's how I think Merit can play the role. I don't think this would be a forum where they can come and try to find research jobs or opportunities like that. It's really more of a provision of knowledge, and if they can tap into this resource while they're in medical school, I think that will be really great. They can listen to these speakers and actually reach out to them for possible research projects. I get a lot of these requests on a weekly basis, and we all do actually, and try to do the best that we can. It also, since we're going to have a lot of young people listening, that relationship is always a two-way street. So that no one is obligated to respond to your emails or provide you with an opportunity if you're unable to deliver. So I think Merit doesn't play that role, but it can provide access to speakers or people who are participating in Merit as content creators, who can potentially provide resources for you, or be a resource for you, and so use that wisely, if you can.
So that again translates to networking that APPNA is really known for, right? I mean, you can use the APPNA platform, the Merit platform, to basically network and get in touch with people or mentors who can help you in that perspective.
Dr. Tariq Bhai, if I can add to that. So we, like Dr. Osmani mentioned, that we did a leadership course last year. So but one few other things that we did, we did that leadership course actually in collaboration with YPC, and for the medical students, the course was free of the cost. And then we also did an research course, more like data analysis for beginners, is still on the website. When it comes to networking and observerships, YPC helps with that, but certainly Merit can help somewhat with skill set. So we did a course on data analysis for beginners. We are currently working on a course content for research, more like about research methodology, clinical trials. That's going to go in effect probably pretty soon. And then I think it was last year or year before, where we collaborated with different research societies in medical school. So for example, Nishtar, Rawalpindi, Allama Iqbal, and some other research societies, we collaborated with them. There were like 7 or 8, and we developed a research course that was purely meant for medical students. So just developing on skill set, but this is a journey. So this is just a lot of good work has been done over the years. So we are slowly building on the top of it.
I think that's remarkable. I was about to ask you about any leadership courses, because there's such a dearth of these courses in Pakistan, especially. I mean, we have a lot of clinical areas where we can concentrate, but leadership. So that leads to the next question. Here in the Western world, there's a big talk about AI in medicine. There's a big talk about digital imaging and things like that. And countries like Pakistan are still, struggling to keep pace with this rapidly emerging technologies and new ideas and frontiers in medicine. So, do you have any things in mind as far as Merit is concerned in transferring these cutting edge topics, like AI and digital printing and radiology and digital pathology, etc., to our friends in Pakistan?
So to answer your question honestly and transparently, at this time, no. And my tenure is ending in next 2.5 months. I think we rely when we extend these courses or educational products back home, we rely solely on volunteers, physician volunteers within APPNA. So I think this can be a course in future about the topics that we suggested. More importantly, I think there are some subspecialties that are specialties that we are lacking. For example, we have not done any work on radiology, surgery, because we have ophthalmology, ENT, because we don't have huge. And as you probably know, we don't have many physicians in those specialties within APPNA. So there are certainly, some areas where we can focus on. But, my desire is while we are doing these educational products, if somehow we can have some impact on policy making in Pakistan. So, for example, we had National Institution of Health, there is a healthcare task force. So how can we have impact more on the policy? I think educational products are happening somewhat. We can build on that, but there's an area where we are lacking is to have an influence on the policy.
So,
Yes.
Sadiq, is there any plan to collaborate with organizations like PMDC or the Pakistan Medical Association, the physician representative bodies in Pakistan?
Yeah, so there are few where we are finding those collaborations, and we have some sort of relationship. So Pakistan Psychiatric Society, being a psychiatrist, in the course that we did last year with infectious disease, MMIDSP, they were involved. And I think for hematology and oncology, there is an organization, Hope, that is involved. For HIV, like I mentioned, there are many physicians from Pakistan who are involved. For family medicine, we are having some conversation or communication with Association or Society of Family Physicians in Pakistan. So more with the physician societies, but not at so much at the government level. And I think it has to be a two-way street.
Yes.
The interest has to be mutual from the both sides.
Sure.
Yeah. So Tariq, I just want to kind of augment that particular point that Sadiq made. So because we have to be pragmatic in what we can accomplish from the APPNA platform, and so having good engagement with local stakeholders is extremely. I think going back to the first point that Sadiq made, that he had surveyed from folks within here as well as back in Pakistan what the needs are, and I think so having that needs assessment and picking out the topics or areas where we can actually provide that knowledge transfer would be very important. So and we're still covering the basics, pragmatically.
Right.
We'll have to cover the basics, and eventually our aspirational goal will be that once you've covered the basis, or basics in each of the areas, then you can try to get to these next level generative AI tools that we can employ, and that too will require a lot of infrastructure resourcing back home. So I would say we have to still stick with the basics, be pragmatic for now, and then we can build on that. I think Merit is in an excellent trajectory right now with all the wonderful work that's been done, especially in the last 5-6 years. I think Sadiq mentioned Danish's name. He's actually done a lot of the framework, a lot of hard work that Sadiq is now continuing to do.
I think that's a very realistic perspective that you've given, that countries like Pakistan are still struggling with some of the basic healthcare, and we really need to fill the gap over there. One feedback which we have received is that there are so many medical colleges in Pakistan, and many of them have a difficult time recruiting faculty members from very unique specialities. So is Merit looking into developing some sort of a grand rounds kind of an initiative, to provide grand round education to medical students from various medical colleges in Pakistan?
Yeah, so a few things that we did, especially last, I really wanted to work on it from the beginning, but about a month ago, we finalized this. We have APPNA Speakers Bureau is going to be launched. Hopefully, we're going to have proper the mechanism behind this, but we sent out an email to APPNA members and asked them who wants to be part of APPNA Speakers Bureau. And the concept behind was that, people who are interested in investing in medical education back home, right?
Mhm.
So whether they are here, whether when they're visiting Pakistan, so having that platform that available, we received interest from over I would say very easily 200 people. So we had to screen some people out based on, the level of expertise they had. So mostly we selected who were the faculty, and then we have a database of we about 10,000 emails from different courses and collaborations in the past. So we sent an email. We created a more like a survey, a Google form where we asked them. Um, if you want a speaker to come to you from APPNA, whether virtually or in person, you can fill the survey and then reach out to us. I think we are still learning from the survey, and hopefully we'll keep refining it. There are some institutions who ask for help, so this is one way to reach out to those newer medical schools and less established areas in Pakistan who struggle to have well-established medical educators.
Sure. You want to add something, sir, to this?
I think Sadik has covered this very nicely. I don't have anything to add.
Yeah. So, next question. I know that this year is almost about to be over, but any exciting projects or topics in the pipeline as far as merit committee is concerned?
So one thing that is going to be coming up, nothing exciting, but medical education. So how to be a medical educator. So this is one area we lack. And you remember there was an incident that happened in one of the Pakistani medical schools more recently, where there was some violence involved. So we are working. So under YPC, we have program directors, roughly about 30 to 35. So my goal and plan is, and this is something I'm going to continue to work on, and hopefully next year it will, or maybe end of this year, this will go in effect, how to be a medical educator. So it's more for medical educators, how to, let's say if a resident or medical student is struggling, how to
Right.
give them feedback, how to help them. If you have to take disciplinary actions, what are empathic ways, and what is a progressive disciplinary action. So that's something that I think help with people in US too, the APPNA membership, but it will also help people back home. And we are working on some what I will say from the operational perspective, we are working on few things for next year, which will happen. So stay tuned. I think this will be a good thing. There is a lot of overlap between YPC, Merit, and RISA. More administrative support for Merit, RISA, and YPC, which already has been approved by this board of directors. So one thing which I felt like, so I worked on YPC, I worked on in RISA as a member, YPC as a chair, and Merit as a chair. One thing that I've seen is that our Merit coordinator, Waleed, has been exceptionally helpful. And this is why Merit has been doing so well, because, as a physician volunteer, I need to have vision. Waleed is someone who puts all of this into reality. So I think once we will have more administrative support, we can do a lot more.
So these coordinators that you have, the manpower that you have, are they paid positions? And if they are, then where do you get your budget from? Does APPNA support you?
Yeah, so I think we currently have one Merit coordinator. We have been approved to hire another Merit coordinator. They are paid by, so I take that back. So we have one main Merit coordinator. We have a coordinator for stroke fellowship, and then we have been approved to hire another Merit coordinator. These are, their salaries are covered by Merit resources. If you even Google APPNA Academy, it will take you to different courses. Our courses have a very small cost. Most of our cost is covered by those educational revenues that we have from educational products.
Sure.
Last year, we didn't ask any educational support or any financial support from Central APPNA. This year, because of the currency depreciation, we had to lower the fee for each course, so that we may have to ask for some. But over the years, if you have seen, and the membership and the leadership, there is a greater desire to have enhanced educational footprint for APPNA.
Sure.
So I don't think we will have any problem asking Central APPNA for help if we need help. I'm sort of preparing the ground here.
Yeah. I think the committee that both of you chair is really something that APNA and all its members can be very proud of. It's really a crown jewel in the big name that APNA has. Saad, where do you see Merit Committee in the next 5 years with your experience this year?
I think the committee will continue to grow. It would be really good to see enduring programs created in all specialities, whether Merit does it on its own or in collaboration with other subspecialty committees or societies that are Pakistani physician focused. I think this will serve as a very important platform. And then, there is, as Sadiq mentioned, this focus on developing leadership skills within the workforce here in the US, and also, providing that as a resource back home. I think for us as physicians, it's an extremely important skill set that we never develop when we are coming back, coming from Pakistani med schools into here, and these are skills that we acquire over time. So it would be really nice to actually develop programs and enable our junior faculty or people who are actually coming through the ranks, in both academics as well as in the private practice to develop those skills. There are different kind of leadership skills that you need to actually be a successful practitioner out in the community. Different kind of leadership skills that you need in an academic setting, and then more and more we are seeing hybrid settings where you have an academic / hybrid private kind of a model. So this is going to be very important for the future of APPNA to develop those skills, and I think Merit can play a very important role there as well.
Excellent. I think that's a fantastic wrap up of the future that APPNA and especially Merit Committee holds. So, before we end, what would be your message to all the APPNA members at large who know APPNA by and large by big conventions and big entertainers? What would be your message to them? That's for you, Saad. And Sadiq, what would be your message to all the young aspiring graduates, who are trying to navigate the committee structure? So we'll start with you, Saad.
I think now more than ever, we should recognize that having a unified platform is going to be very important for us here in North America. So we have to strengthen each other, back each other up, as well as develop more professional and leadership skills. We have to recognize this as a community at large. Yes, is a very good social platform for us, and it's always fun, to meet with friends and
Sure.
have fun. That's all great. That's a very important part of the platform as well as our culture. So, but I think we have to move a few steps ahead of that. We have to develop professional leadership skills. We have to strengthen advocacy efforts, and really come together on this platform and really make this a very important, impactful platform that can influence policy in this country as well as back home.
Excellent. So Sadiq, about how would you advise, or what will you advise those young members who are navigating committees and how to be involved in APPNA?
Yeah, so I think the recipe is probably almost the same. So when I started to work in APPNA, So I was part of, as member of IPC and doing all those things. But I think the real journey started within my alumni. So I served from treasurer, general secretary, president-elect president in, I think it was 2022 when I was, or 2023 when I was serving as president of National Alumni. Then in 2023, I was chair of IPC and then married. So I think there are many ways where you can, serve. It can be from specialty networks. So, for example, one of the course director for infectious disease last year was Dr. Farhan Ahmed. So he is a young graduate from King Edward.
Nice.
And so he did that, and you can also serve in the chapters and in the alumni too. So there are many sort of paths that you can take to grow up into get into the central leadership. And the first question that you asked was why. I think why younger members should come to APPNA. I think there is a social piece to it. APPNA is, if you look at APPNA, is a multi-ethnic. It is an ethnic organization, right? So there is a cultural piece to it. There is philanthropic piece to it. So if I have to do it, like look at APPNA's functions, I will say that there is a social piece, the heritage and culture that the platform that it provides us. Then there is a philanthropic piece.
Sure.
So just looked at Dr. Mariam Shaukat, we raised $400,000
Mhm.
in mere 36 hours. No organization can do that. And this is not the first time. In
Mhm.
COVID, we raised $1 million
COVID. Yeah.
in COVID, right? If you look at the advocacy piece, and advocacy and mentorship and networking, just this year when there was a national freeze on J1 visa, and when it opened up, Pakistan's J1 visa interviews opened within 3 days, while it took many weeks for other countries to open up. So yes, we can do more. And on the education end, I think we are lagging behind, but we are trying to, there are different committees that are working on that, YPC, Merit, and RISA. I think, there is more investment from the leadership that needs to be there. But no other organization provides you this vast opportunity. Like you can do work on philanthropy, you can work on the cultural piece of it, education and advocacy. I personally feel very privileged to be part of APPNA, to be a member of APPNA, and to be a volunteer of APPNA, because it gives me an opportunity to connect with people, people from back home in US, and then it gives me an opportunity to serve in the capacities where I want to serve that also aligns with my professional interests. So become an APPNA member, work on things that you feel like needs to be worked on, and opportunities are there.
I think that is remarkable, and you really summed it up well. And I think we all love APNA, and this is manifested in the increasing number of membership that is consistently growing year by year. And the work that you, as committee chairs, do all on a volunteer basis, deserves a lot of appreciation from every member who's watching this. So, once again, Saad Usmani and Sadiq Naveed, thank you so much for your leadership. Thank you so much for your vision. Thank you so much for all the volunteers that you have put in to do what you do for people in Pakistan and truly, making APNA a very relevant organization. So thank you once again for your time and for agreeing to be here on such a short notice.
Thank you very much.
Thank you so much.
So with this, ladies and gentlemen, we come to the end of this episode as far as APPNA Committee Cafe series is concerned. And hopefully we'll see you next time with a different committee. Thank you.